While the vast majority of both soldiers and civilians experience trauma in their lifetime, post-traumatic stress disorder, or PTSD, is only found in about 10 to 20% of those who were traumatized, and it doesn't occur in the other 80 to 90%. Hi, I'm Dr. Kerry Ressler. I'm a psychiatrist and the chief of the Depression and Anxiety Division at McLean Hospital. And these are your most frequently asked questions about PTSD. What is PTSD? PTSD is a severe mental health condition that occurs in people who have experienced or witnessed a severe, life-threatening trauma. What are the symptoms of PTSD? PTSD is associated with 4 sets of symptoms: intrusive thoughts including nightmares and flashbacks, avoidance of reminders of the trauma, hypervigilance with increased startle and arousal, and finally decreased concentration associated with increased depression. Together, all of these lead to PTSD being a very disabling condition associated with increased suicide risk. Do only veterans suffer from PTSD? In fact, civilians have as high a rate of post-traumatic stress as veterans. It was originally thought that primarily PTSD occurred in veterans, but we've known really since the 1970s that interpersonal assaults, sexual trauma, those with high rates of childhood trauma, and those living in high-risk neighborhoods and high-violence areas may have post-traumatic stress rates as high or higher than in the veteran community. Importantly, PTSD occurs in about a 2-to-1 rate in females compared to males. This may in part be due to increased interpersonal assault and sexual assault in females, but we also believe that it's related in part due to biology, such as differences in sex hormone levels that may have both protective and risk factor roles. Why do some people suffer from PTSD but others don't, even though they've experienced the same trauma? Why is PTSD only happening in about 10 to 20% of those who've been traumatized? Well, we think that it's because of 3 different sets of factors. 1, biology and genetics that are different. 2, the level of lifetime trauma one has been exposed to. And 3, resilience factors, such as the ability to adapt to change, using positive coping skills such as humor, and how one responds to a difficult situation. It's important to remember that PTSD is treatable. Despite the need for more progress, we actually have good treatments at the therapy and medication level that work in most people. So if you or a loved one is experiencing signs of stress and post-traumatic stress symptoms, please seek help. We have good options. Thanks for watching. I'm Dr. Kerry Ressler. For more videos on mental health, click here, and don't forget to subscribe by clicking here.